Welcome to Your Health. We talk about physical conditions and physical illnesses a lot, and rightly so. It's very important. But today we're going to concentrate a little bit more on mental health and mental health issues. Mental health has kind of stayed in the background for many years, and people tend not to talk about issues or things that they think might be mental health issues. But it's finally coming a little bit forward and a little bit easier to talk about. And that's what we're here to talk about today. And my co-host, Dr. Laura Boyd, is with us again today. Good morning, Dr. Boyd.
Good morning.
And you've brought a guest.
Yes, I have with us today Annie Jaworska. She is a physician relations coordinator with Linden Oaks Edward Elmhurst Healthcare. Annie is a licensed professional counselor and certified alcohol and drug counselor, and she's practiced in the Elmhurst area and has many patients actually in the Addison area too.
Well, you know, it's, as I said, I think it's finally becoming okay to talk about issues that are not just physical issues. And Dr. Boyd, you see patients every day. They come to you because they have a physical condition that they think might be the problem. But then in talking to them, you find out it's not as physical. What do you do? How do you deal with that?
Yes, a lot of patients will come in. There are a number of patients that come in right away knowing what they're feeling. They know that they're feeling depressed, or they have depressive symptoms, or they're feeling anxious. But often they come in with symptoms that are due to those things and they don't realize it yet. They might say that they're not sleeping well, or they're having decreased appetite or increased appetite, or they might be sleeping excessively. Or sometimes they'll just say that they're not getting along with family and friends as much, and they don't understand why their mood is going up and down. And really spending the time talking to the patient and working through why they believe they're having problems with sleeping, or why they're sleeping excessively, or why they're not eating, starts to bring out the fact that they are having some depressive symptoms or anxiety that is causing all these physical ailments also. And often, as a primary care physician, there are things that I can take care of, either with medication or referrals for therapy. Often we do both right away. And there's some things that as a primary care physician, I will refer right away to a psychiatrist, someone that has something a little bit more chronic, like bipolar or schizophrenia. They're going to need to be on more lifelong medications that are a little bit different than I would want to or feel comfortable prescribing as a primary care physician.
See, in bipolar and schizophrenia, those are lifelong issues. But there's a lot of short-term. Postpartum depression, which is most often short-term, seasonal.
Yes, yes.
The sun makes a big difference,
Yeah.
and in this Midwest area, you don't see that the sun too often, and it does affect some people.
Yes, unfortunately, 20 to 25% of adult Americans at some point will have had either true depression or depressive symptoms, and people sometimes are afraid to tell me about it, or they feel shunned about it, but they really shouldn't. I tell people all the time, this is actually extremely common. People just unfortunately don't talk about it, and they should, because it's something that a physician can help them through.
And there's a lot of help out there now, which in the past that really wasn't the case. People didn't know where to go. They didn't know that they can talk to their regular physician and find out what the condition really is. And we talk about adults. This also affects children.
Yes, unfortunately, teenagers, it's a huge issue. And we have a lot of great programs too in the area that help. And that's one of the things with having Annie and having the Linden Oaks group is so helpful for us as primary care physicians, because we need someone outside of what we're not trained to deal with a lot of this, and we're able to contact them and coordinate. And it'd be great for Annie actually to explain a little bit more about Linden Oaks for us now.
Sure. So Linden Oaks is a full-service behavioral health organization serving adolescents, adults, and older adult patients. Linden Oaks treats anxiety, depression, bipolar disorder, eating disorder, chemical dependency, dementia, and self-injury. Our main campus is located in Naperville at 852 South West Street. That is where Linden Oaks Hospital is at. That is our inpatient care, inpatient hospitalization, where we have 108 beds there for adult, adolescent, eating disorder, chemical dependency, geriatric, and special intensity units. We also have outpatient programming. So outpatient programming includes partial hospitalization and intensive outpatient programming. Partial hospitalization is a full day program. Intensive outpatient program is a half day program. So we have outpatient programming, again in Naperville, in Hinsdale, St. Charles, and Plainfield. And we also have a Linden Oaks medical group. So this is follow-up care for individual therapy and psychiatric services. And our locations for the Linden Oaks medical group is in Naperville, Hinsdale, St. Charles, Plainfield, Woodridge, and Yorkville. And actually, Linden Oaks Medical Group is the largest psychiatric group in the state of Illinois.
Does insurance cover any of this?
Yeah, I mean, for a lot of my patients, it's 50-50 sometimes, unfortunately. Sometimes they have good coverage, sometimes there's a copay, which I think that holds back people often. Sometimes I will try to explain to them how important it is, though, to follow through with seeing the therapist and setting that up as part of their overall health care. They always think just the mental is not as important as physical, but really it's 100% as important. Because if someone mentally is not feeling well, they physically are, that increases risk for heart disease, really, and other ailments. And people don't think that way a little bit broader.
Right.
Eating disorders.
Right. And with mental illness, it's not only in the mind, but it's also physical symptoms as well.
That's what I'm saying. Eating disorders, I mean, they can die from eating disorders. And that really can be controlled or helped.
Correct. Especially adolescent. I think that's, for me as a primary care physician, that's been a little bit disheartening, seeing how many more young women, girls, and men are battling with this at young ages, 15, 16, and ultimately it's going to completely affect their high school years, which then could affect their college, because they're not doing as well at school, or they're pulling back and they're getting really depressed, and they're not being as active, and they're not joining clubs and all that, and really having somewhere to refer to is huge, because it's really disheartening when I have no one to send them to or no one to treat, because obviously that's a little bit more intensive, and sometimes they need inpatient. I've had patients that have gone inpatient as adolescents to the Linden Oaks program, and it's been really great and helpful.
And they can become more productive adults. It's like anything else. If you find it soon enough, you treat it soon enough, and it's dealt with. Mm-hmm. But if you wait too long, it's much easier to fix something that's not totally broken than to try to put something back together that's totally broken. So find it in the younger kids.
Right.
Correct.
I worked with adolescents prior to this role, and I found that they were very receptive to the treatment, and I saw great progress in the adolescents. They really got better, which was really nice to see at a young age.
They're less rigid. They're more open. The younger the mind, it's more like a sponge. Children learn so much when they're young. That's why they're in school, because they learn so much when they're younger. And learning about your mental and your physical health is very important, I think.
Right.
Correct. Yeah, and sometimes I see, unfortunately, parents or mothers that have gone through depression put their thoughts on how we should deal with the adolescent with depression. Sometimes they say, well, therapy didn't work for me, so I don't think it's going to work for her. And I said, well, it's very different as adolescents. Sometimes therapy is all that we need. We really kind of hold back on medications, just because obviously there's potential side effects with everything. And with the young, we don't really want to put them at risk. So therapy is always kind of the mainstay, and we go pretty quickly to that. And that's with the Linden Oaks program, it's been great because as a physician, all I do is put in a referral, and whether or not they're going to help, the coordinator helps them get an appointment with Linden Oaks, or sometimes it's completely a different place because their insurance won't let them go to Linden Oaks. But
really?
It's been absolutely an awesome program for us as primary care physicians to have something quick to refer, and then they're following up with them. It's been great.
And they follow up, not jumping to the medication first. I really like to hear that.
Yeah, correct. Yeah, and basically, and I'll get notifications like we call the patient again, because often patients will not go the first time. They will not go the first time. They won't go the second time. Hopefully, the third time that you call them or you talk to them. And even in the office when I see them, they will not go to the therapist right away. It takes a lot. Because people, it's hard for them to talk about why they've come to the place that they're at, and they don't want to talk to about a stranger. But often I always tell patients I think that's the best person they need to talk to, and not have it be a family member or a friend that's going to put their own kind of, not 2 cents, but they're not a professional in it. So I really push them to go see a professional therapist.
And I think it's important they talk to someone other than family members, because I think especially, I think everyone, it's easier to talk to a stranger about something that's really bothering you than a family member.
Correct.
I don't know why, but
you hold back.
You do. You hold back, and I think it's just normal.
Yes.
But
I just recently, I think about it, I had a patient this week that saw me and said, "Thank you so much for finally making me go." And it was something that they kept calling her. So she finally said, "Okay, I'm going to go." And she's seeing a psychiatrist, she's seeing a therapist, she's doing much better. But she needed all of that. But it was really hard for her to come to terms and go finally make that step. But I think it was kind of the constant reminder and a constant help to get her there that helped.
And I don't think sometimes you realize what your conditions really are.
Okay.
Yes. And you alluded to something that kind of interested me. Is mental health sometimes hereditary?
Oh yes, for sure. I mean, depression, anxiety, especially, and in the bipolar, schizophrenia, all the chronic ones too. I don't know if you want to talk about that at all.
Sure. So I would love to talk about the navigation service that you were talking about, getting people into treatment, which is why Linden Oaks started this service. It's called Primary Care Physician Behavioral Health Navigation. So what we noticed is that the behavioral health care system, it can be described as confusing to some people, to families, to patients, to physicians, to anybody. And, people wonder, like, who do I talk to? Where do I go? Where can I get some help with this? And so we started this service where the patient will go see their primary care physician, so they'll see you, Dr. Boyd, and they might be coming in for like an annual checkup, or just to see you for something, and they might say something like, I'm feeling kind of depressed, I'm feeling anxious, I'm having a lot of stuff going on in my life right now. From there, you determine if the patient needs the service, and if they do, if they're not needed for emergent care, then Dr. Boyd, you'll put in an order into the system, and then from there, a dedicated mental health specialist will reach out to the patient. And this is a great service because most of the time the patients don't know what their options are, so we can kind of talk about what's going on with them, gain that collateral information, and connect them with the services that they need. And then from there, the navigator will reach back to the primary care physician to update the doctor on what we're doing with this patient. And it's a great service because we're working with all types of insurance, so it's not only insurance that is accepted by Linden Oaks Behavioral Health, but we're working with all types of insurances, all types of providers, and really it's about connecting the patient with the behavioral service that they need to get that help.
We don't, and there's things that, and I talked about seasonal depression. How do you notice and differentiate between what's it called, seasonal affective disorder?
Yes.
Sad.
Yeah.
Sad.
Yeah.
How do you? I mean, you know, because
Nice
the
acronym.
house looks great at Christmas and New Year's, and then you take everything down, and it's like, oh,
Correct.
and the
Right.
lights are bright, and people are so uplifting through holidays. It starts at Thanksgiving, and it kind of crashes
Starts
it
to go
after New
downhill.
Year's,
Yeah,
right?
yeah.
And then you try to lift
Yeah.
yourself up for Valentine's, and down you go again. You
Yes.
know. But how do you determine the difference?
Well, seasonal affective disorder, it's a subtype of depression, so very similar symptoms of depression, but seasonal affective disorder typically occurs when there's changes to the seasons. Typically, most people with seasonal affective disorder, they'll notice these depressive symptoms beginning in the fall and occurring throughout the winter months.
Really? Okay.
So, in other words, sometimes it's known as the winter blues. But also seasonal affective disorder can also occur in the springtime and the summertime.
Really?
Yeah, so the difference between seasonal affective disorder and depression is that it's changes with the seasons.
Okay, and it doesn't have anything to do with the visibility of the sun and just the dreariness and the darkness? It doesn't really have anything to do with that?
It's one of the factors.
Okay.
Right.
It's the one I think most of us kind of can relate to because it's something we can physically see.
Well, in the Midwest, yes.
In the there's other places other than the Midwest? You mean there's places that it's
Chicago.
sunny?
Yes.
Oh.
Well, it's often I'll tell patients if they'll see me around December or November and say, well, I want to start getting off this medication. I say, not right now. I often will say, we can go really slow, but really maybe in the spring, because it's just not a good time for a lot of people, and they start to feel a lot of angst. You're stuck inside. The sun is not outside.
Stuck inside, you don't see as many
Correct.
people.
It's not a good time to try and come off of an antidepressant that you've been on for 6 months. You know, so often I'll say, okay, let's just hold off, and we could start the weaning process, but not really completely go off of it until the sun is back out.
And I think the holidays can be very daunting and stressful for people who are experiencing mental illness, because they may feel isolated or alone, or they go through the holidays and then they're disappointed because the holidays are not what they hoped they would be. So it can be a very stressful time. But we're noticing too that there's an increase in patients getting treatment in January, so after the holidays. And this might be due to patients having insurance, so being covered by insurance.
Yeah.
Perhaps this is a New Year's resolution where, it's January, I want to get the help that I need. So we're noticing that there is an increase for mental health treatment after January.
I definitely think a lot of people come in December. For me, as the primary,
Really?
they come in December and start telling me about the
avoid
problem.
you at December. I don't want to know what's wrong with me until after I clean the house up after the holidays.
I feel like right after Thanksgiving and right before
Really?
Christmas, I mean, people start to get the angst and the depressive type symptoms, and so
Right.
that's why they end up in behavioral health by January. Which awesome people are coming in when they come in and recognize it, and I think that's half the battle is to finally say something to someone, whether it be your physician or your family friend. Hopefully would bring you, push you to come in and see your physician or
Right.
seek treatment.
See, and the other thing is I think there's a lot of issues that people don't realize are related to some sort of a mental deficiency or disorder. I hate to say the word disorder because it's all fixable. If most of it is fixable. But panic, fear, uneasiness, and like what you were saying after the holidays, it's like it's a letdown. Same with the wedding. When you're planning a wedding, it takes you a year to plan the wedding, and then it's over in one day, and it's like, now what? You're kind of all geared up and wound up, so you get that fear and that panic through that time, and then all of a sudden it's a big letdown.
Yeah, sometimes you're almost too busy to recognize what's happening, right? And then you have the time. So I think that's sometimes too probably why January is a month that people start to come see a therapist or come see behavioral health, because November, December is crazy busy, and then all of a sudden everything's kind of calmed down and they start to kind of reflect a little bit of what's actually happening.
Well, there's all kinds of simple little things that I was reading that kind of are triggers or things you should notice: dizziness, dry mouth, nausea, muscle tension. What do you mean by muscle tension? Is those like
often
cramps?
People will becoming in actually a lot of upper back and neck pain and headaches.
Okay.
Headaches is a huge anxiety. That's why we call them tension headaches. Yeah.
Shortness of breath is another. These are all symptoms.
And those would be like more like a panic attack or like an anxiety attack. Like those extreme symptoms like that. Like that dry mouth, shortness of breath, chest pain. That would be like a panic attack.
So those are kind of panic attacks.
Like more
okay, sometimes it's okay to have a panic attack because something is going to be happening and you're really getting nervous. For example, coming onto a set and just talking to one another. You get a panic attack just before the camera goes on. But if that continues on or it just happens for no reason, that's a whole different thing.
Right. Yeah.
Right, because then if it keeps happening, then it's disrupting the person's daily functioning. It's happening randomly. They don't know what maybe the triggers are. They don't know when it's going to happen. So from there, they may need to look at getting some treatment for that.
I think the most common time for me is someone will come in is because they can't drive. They can't go somewhere anymore, because often panic attacks happen in the car. And so when they start to realize that they're not going to the grocery store, they can't pick up their son or their child from school, is when they finally realize that they need help.
And yes, and that's really kind of scary. I can understand.
Right.
Now, we're getting close to the end of this program, but I really want to talk about something that I feel very strongly about. There's a program that Linden Oaks and Elmhurst Hospital are involved in, and I think it's a wonderful program, Mental Health First Aid.
Right.
And I know you work with that very closely.
So mental health first aid training, it's a public educational program. So it provides education to the public about the risk factors and warning signs of mental illness. It's an 8-hour class. You can also think of it as like the CPR version to mental health. And it really just provides education about mental illness to the public, so that they have more of an awareness and understanding of what it is. So during that 8-hour class, you'll do some role plays, you'll do some simulations on how to offer help to someone who might be in a mental health crisis. It's a really great training program. There's different types of training programs for mental health first aid, and Michelle Obama even took the training. So
really, you see, and I think these are kind of important things for police, fire. They can be going into a situation that it's not a violent situation; it's more a mental health condition or something, and if they notice that, they know how to act and react.
Right.
I also think it's very important for educators.
Yes.
And not the students and not the parents, but more I would say maybe counselors in schools. Yeah. And this is a program that's offered through Linden Oaks.
Right, and for more information, you can go on the Edward Elmhurst Healthcare website.
And I want to make certain we know how to contact you, Annie. And so would you tell our audience how they would contact you and where they would contact you?
Sure. So for immediate assistance, for a free confidential assessment, and for our 24/7 helpline, you can contact 630-305-5027.
And that's 24/7, correct?
24/7, correct.
And it's just consultation. They can call if they have an issue.
Right. You can get a free confidential assessment, and it's also a 24/7 helpline.
Okay. And Dr. Boyd, tell our patients how to find you here at the Elmhurst Clinic.
Well, I'm over here in Addison. The phone number is 331-221-9001. I'm at 303 West Lake Street.
Well, we thank you both. Thank you, Dr. Boyd. We'll see you next month. And Annie, thank you so much. It's been extremely informative today.
Thank you.
Thank you all for joining us. I'm Lucille Zucchero with Dr. Laura Boyd and Annie Jaworska. And here's to your health.